Hello, everybody. Professor Miller and I are going to be demonstrating the head-to-toe integrated assessment for you. So this is utilizing your final assessment documentation, what the expectations are for not only your ability to demonstrate the assessment, but then your explanation of your findings. And remember that we will be having a post documentation as well, looking at your objective and subjective findings. Objective being what you clinically find on your patient, and subjective being what the patient states. Okay, so we're going to go ahead and get started.
Come in.
Hi, Professor Miller.
Hi.
My name is Professor Deardoff, and I'm going to be doing a head-to-toe assessment on
Okay.
you.
Okay.
I'm going to do some hand hygiene. Are you not feeling well?
I think it's just Oklahoma allergies.
Oh gosh, dang it. They always get us.
Yeah.
So make sure that I do hand hygiene so that I have clean hands for my assessment for you.
Okay.
And then we're going to be doing a head-to-toe assessment, meaning that I'm going to look at you from the tip of your head down to your toes, assessing various attributes of your body to see where we're at, and kind of go from there. Can I ask you your name and date of birth?
Okay. Do I have to tell the truth?
No.
Okay. I am Catherine Lynn.
Okay.
Okay. Empress of Russia.
Oh, wow.
Date of birth, let's see, a good one. I was born August 19th. I'll go for 1940.
1940. Oh,
Yeah.
my.
Which is a
And
lie.
remember, students, you do not need to falsify any information. We're not looking for, if my client's having a heart attack. If you want to see your partner's assessment skills, by all means, you can make up something fun. But for this, we're expecting a within normal limit for this person's baseline. Okay. Anywho's it. Do you have any allergies to medications?
Yes.
Okay, what are those?
I'm allergic to CT dye.
Okay.
And an old antibiotic I used to take. I haven't had it in like 50 years.
Oh, wow.
So.
Something like penicillin, maybe? Does that sound familiar?
I took it for mono, actually.
Oh.
Tetracycline.
Oh, tetracycline. Okay. All right. I'll make sure that that is in your chart. Looks like it is. All righty. So now I'm just going to verbalize some things of my observation. So I can see that your general affect is pleasant, that you're engaged with me, you're well groomed, and that your speech is appropriate. Are you a native English speaker?
Yes.
Perfect. So there's no need for a translator. And I can tell that her noted behavior is she's cooperative and seems to be in a pleasant mood. Okay, now moving on to your vital signs, I'm going to be assessing your blood pressure as well as your pulse and your respirations. So if I could have you kind of turn yourself towards me, put your feet on the ground. Excellent. I'm going to put this cuff on your arm, making sure that the arrows point to the left and right artery. Perfect. Okay, and make sure got a good brachial pulse. Excellent. Would you mind holding that for me?
Sure.
Thank you. Okay, so you're gonna get a nice squeeze on your arm, and then it's gonna tell me what your blood pressure is. All right. Okay, nice good squeeze, and then a slow relax. Well, Professor Miller, you are in excellent health because I got 122 over 76.
All right.
I know. Beautiful. Okay, so now I'm going to be assessing your pulse and respirations. So forgive me as I kind of rearrange myself a little bit to look at that clock. Okay, finding that radial pulse. gonna wait till it gets to the 12 hand. All right, here we go. Okay, so I got 42 over 30 seconds, so that would be 84, which is perfect. And now generally we wouldn't tell our patient that we are assessing their respirations, but I would be observing for the next 30 minutes, or 30 seconds, excuse me, and see that we are about 14. So that sounds good to me. Looks like you're in great health. Moving right along, I'm going to assess you for your pain. Are you experiencing any pain today?
Not right this minute.
Not right this minute? You sure you're not feeling any pain?
Well, actually, my ankle hurts a lot.
Your ankle hurts. Can you tell me which ankle?
My left ankle.
Your left ankle. And how would you describe that pain? Would it be a burning pain, a sharp pain?
More like burning, hard ache right in there.
Okay, so an ache kind of at that arch of your foot?
Yeah.
Okay. When did this happen?
I've had it for a couple of years.
A couple of
I had
years?
some therapy on it.
Oh, I'm sorry to hear that. It's been bothering you. And that specific location, does it go anywhere? So it's on the arch of your foot. Does it stay there? Does it go elsewhere in your body?
It stays there now.
Okay, so kind of isolated. And then is this a continuous pain? Is it always hurting or is it off and on?
Just when I walk on it.
Okay, and then what causes it to, just when you walk on it? Okay.
Mm-hmm. It pronates and collapses and stretches in here.
Okay. So when, would it be safe to say when you have heavy activity that it would kind of bother your foot?
Standing a long time or walking a long time.
Okay, so that would make it worse?
It makes it worse.
Okay, and then anything that makes it better?
When I get home at the end of the day, I put it up a
Nice.
lot and sometimes I'll massage it.
Okay, sounds like you know how to take good care of yourself. And is there any other symptoms? Do you feel any nausea, dizziness, anything from that pain? Okay, and it's non-radiating?
Non-radiating.
Okay, so it doesn't go anywhere else in your body. Okay, good to know. All right, so now I'm going to be doing a general assessment of your skin.
Okay.
So it looks like you are appropriate for ethnicity. I see that your skin looks maybe just a little dry. I know that we've got that season change. But definitely you've got good perfusion. We've got a nice pink undertone. I can tell that your skin is nice and warm. And since I'm assessing your skin, I'm going to go ahead and look for other signs of perfusion. The quick pinch on your fingers. Okay. Looks like we had a cap refill of about 2 seconds, which is wonderful. Excellent. Thank you for letting me do that. Okay. So with your skin, I'm also looking at your nails, seeing that your nails are very well groomed and very cute for Thanksgiving and fall. I'm not seeing any indications of clubbing or spooning. I do see some nodules for potential arthritis. Would that be correct?
Yes.
Okay. Are those causing you any pain?
Weather related.
Okay.
And on the right, I'll have some pain across here, but
Okay.
it's if I try and squeeze them tight, so I don't.
Okay. All right. I'll keep that in mind when we move on with our assessment. Alrighty. So the last thing I'm going to assess is your skin turgor. So this is looking for signs of systemic hydration. So quick little pinch. Looks like we have just a little bit of mild turgor or tenting. But it still has a nice elasticity to it, and I would attribute that more to your older age.
My alleged birth of 1940.
Than dehydration status. And another way to indicate that would be on your collarbone. Keep testing your skin turgor. Okay, moving right along, we're going to be doing your neuro assessment. So, what is your name?
My name is Kathy.
Kathy, okay. And where are we right now?
We are at Southern Nazarene University.
We are indeed. And what is that we're doing right now? What are we doing right now?
We're doing a physical assessment.
We are. And then can you tell me what season it is?
It is late fall,
Late fall.
mid-fall,
Okay. And the year?
2022.
Excellent. You are oriented to person, place, situation, and time, and you are obviously alert and well coordinated in your speech. Okay, so I'm just looking at you. I see that we have some facial symmetry that right along midline. I'm seeing that your eyebrows, eyes, and mouth are all symmetrical. I'm not seeing any facial drooping that I would be concerned about. And then I am going to be assessing your cranial nerves. So the first one, if you want to go ahead and close your eyes for me, I'm going to be the olfactory nerve. So I'm going to put this under your nose and tell me when you can smell it.
No.
Okay, and what is it that you're smelling?
Let's smell it again. See, I've got a cold.
That's okay.
It smells between sweet and pungent.
Sweet and pungent. Would it be like a candle or a cleaning solution?
More like a cleaning solution.
Okay, you're correct. It is an alcohol swab.
Okay.
And I can see that you've got that little bit of nasal congestion going on, which that can obstruct our sensitivity to smell. But it seems that it is your olfactory nerve number 1 is still intact. Okay, now looking onto our optic nerve, can you tell me how many fingers I'm holding up?
3.
3, wonderful. And I see that you're wearing glasses. Do you have any other visual aids that you use or visual deficits?
Just a deficit, blindness on one side.
Okay, awesome. And which side is that?
It's the left side.
Your left side. Okay, thank you for letting me know. So we're going to be looking at your cranial nerves number 3, 4, and 6. So the ocular motor, the trochlear, and the abducens. So I'm going to have you follow my finger, follow with your eyes, not your head. And we're going to go nice and slow, looking at the different movements of your eye. Excellent. And you can do this spoke in whichever order makes sense to you, as long as it's a rhythmic pattern. Okay. Okay, and then you're going to follow my finger onto your nose. Okay, and that is testing our accommodation.
Okay.
All right, so now I'm going to skip just a little bit and continue to assess your ocular motor nerve and do the pupillary assessment. So we noticed that you stated that you had blindness in the left eye. Does it typically react, or what is a normal reaction for that?
It'll move, but I don't think it reacts.
Okay, well, let's see.
Let's see.
Okay.
No, huh?
No, I don't think so. That's super interesting. Okay. Awesome. And then we're looking on the other side. Beautiful. Alrighty, thank you very much. So in Professor Miller's case, we would not say that our pupils are equal
Or round.
or round. Well, they're round. This
No.
one's a little ovally.
Well, this was painted to be round.
Yeah, it looks round to me.
My natural one is not.
Oh, yeah, it's a little deviated. I thought you were just looking down.
Mm-mm.
Oh, you're fascinating. We'll have to have the students look at you.
It says coloboma that goes all the way
Oh, yeah, look at that.
goes all the way back to the retina.
Wow. It's almost like you can see, you can see the retina. That's
Mhm.
fascinating.
Yeah.
Thank you for letting me
He said
assess
that was an indication that could have been born blind on both sides.
Wow.
So unlucky.
Yeah. So it's painted, you said? So is it a false eye?
Yes.
That is a beautiful false eye. And I'm amazed that you have motor movement of it too.
was, yeah.
That's so cool. Okay,
So a false
we all
eye-
need to look at Professor Miller's eyes.
So they're not round like marbles.
No.
They're shaped like this, and they form the eye socket like this, so it fits like that.
Oh, how fascinating. Yeah, I really thought that that you were just kind of looking down, but it is your
Mhm.
pupil is lower.
They used to call it a cat eye.
Hmm.
And so the way I look out of my eye,
Mm-hmm.
there is scar tissue. I look out at a different angle,
Uh-huh.
than most people.
Yeah.
And there's scar tissue on the capsule from when I had cataract surgery. So daily I have to dilate the pupil so I can see around the scar tissue.
Wow. So you have to manually or medically.
A drop. Mm-hmm.
Wow. Look at you go.
And when it wears off, everything is just blurry, like I'm looking through a foggy window.
My goodness. And you are a testament to making it work. If Kathy can do it, we all can do it. Wow, that's awesome. Well, I would say that your nerves are intact,
Okay.
and spectacularly so that we're able to move that false side of yours as well. Okay, so now we're going to move back to our trigeminal nerve, number 5. And so I'm going to, I have this swab right here,
Do
and
you
I
want
want
my
you to tell
glasses?
me, you can take them off.
Okay.
I think that's fine. So this is dull,
Okay.
okay, and this is sharp.
Okay.
Okay, and so I'm just going to be touching various parts of your body or your face, and you tell me what you feel. Okay,
Okay.
go ahead and close your eyes.
Sharp.
Okay,
Dull. Sharp. Soft.
so soft
Dull,
is dull.
dull.
Yes, yes. Okay, excellent. And now I'm going to test your mandibular function with trigeminal nerve number 5. So go ahead and clench your teeth. Perfect, beautiful. Okay. And now we're doing number 7, which is facial nerve. So this is the motor of your face. So I want you to lift your eyebrows for me. Lift, 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 lift. Good job. And then can you close your eyes and clench them shut? Don't let me open them. Good job. And then puff out your cheeks. Good job. And don't let me push them down. Good. Very good. And then show me your teeth. Excellent. And we are very symmetrical on both sides. That looks good. You've got excellent motor function. So now we're doing the acoustic or the vestibular-cochlear nerve. So I'm going to be whispering something. I want you to tell me what I'm saying. But before we do that, do you have any hearing assisted devices?
No.
No? Okay. So just let me know what I'm saying.
Okay.
Head to toe.
Head to toe.
Okay.
Final exam.
Yes, that is absolutely correct. Okay, now we're doing the glossopharyngeal nerve, number 9. And how we're going to be assessing this is I just want you to stick out your tongue and say, ah. Beautiful, your uvula raises. And while I'm in there, if you just want to, I'm looking at the mucosa of the mouth, looking very well hydrated, good, nice and moist. Our tongue is pink. I'm not seeing any dry patches or pale parts of your inner mucosa, and that your teeth are intact. I'm not seeing any abscesses or signs of trauma. Okay, moving right along to our vagus nerve number 10. We're not going to actually test this one, but I would test it with a gag reflex. Cranial nerve number 10 kind of wanders throughout your body and is that rest and digest parasympathetic nerve. So it can control and lower your heart rate as well as your rate of digestion. Now we're going to be doing the the accessory nerve, cranial nerve number 11. So I'm going to put a little bit of resistance on your shoulders. Go ahead and shrug for me. Excellent. And now I want you to turn your head against my hand, okay? Turn, excellent, and turn, beautiful. Great job. And then the last cranial nerve, number 12, is the hypoglossal, and that is going to just see if you can move your tongue. So go ahead and stick out your tongue and waggle it back and forth. Beautiful, beautiful. And again, very symmetrical, not having any concerns. Okay. Lastly, for our neurologic exam, I'm going to do extremity sensation. So go ahead and close your eyes, and I want you to tell me which finger am I touching?
My right thumb.
Right thumb. Okay. And what about now?
My left little finger.
Okay. And what about now?
Tops of my hands, both.
Perfect. Perfect. Keep those eyes closed. I'm going to do your toes. Okay.
Tops of my feet.
Okay.
My right pinky toe.
Mm-hmm.
My left big toe.
Beautiful. Great sensation. All right, now we're moving on to our head, eyes, ear, nose, and throat. So I'm just going to be palpating your head. Let me do some hand hygiene since I just touched your feet. Okay, any pain when I'm palpating?
No.
Nope. And I am seeing that your skull is normal cephalic, that your hair distribution is even. There's not any balding patches,
Okay.
and that I'm not seeing any parasites or lice, which is awesome. I'm so happy for you.
They
And
can't look for that in school anymore.
really? Ooh, nice one. So I'm going to be inspecting your nares. So
Okay.
if you just want to kind of tilt your head up for me, looking in your nares, they appear patent, and I'm not seeing a deviated septum. Perfect. And now we already discussed your hearing and vision. I'm just going to do an external look at your eyes. So it does look like we have just a slight drooping of your eyelid on the left side, but based on your history, I believe that that's normal for you.
Yeah, and actually it's been surgically corrected, so it was a lot worse.
Oh, well, it's not very noticeable. It's just from my assessment. And I can see that your eye structures are otherwise symmetrical and intact. I'm not seeing any signs of injury, trauma, or illness. There isn't any excessive discharge, things that I would be worried about. With that, no swelling, discoloration. I'm going to do the same and look at the external structures of your ears. So, left side, looks like we have nice and pliable ears, no signs of trauma or illness. I'm not seeing any discharge or excessive earwax. Looks like you do have earrings. That's the only, if we can call it scar tissue, you have pierced ears. Okay, so now, can you tell me about your swallowing? Do you have any difficulty with swallowing? No? Wonderful. Good time to assess that would have been with our cranial nerves. And then I'm going to palpate your lymph nodes. So I'm going to put my hands on both sides and feel with the 3 finger pads of my fingers, okay? So we have our pre-auricular, our post-auricular. I'm going to put your hair back here so the students can see.
We don't end up.
Yes, I think that would be helpful.
So a headband might be a good thing to wear.
This is true. This is true. Okay, so we have our pre-auricular, our post-auricular, our tonsillar, and then we have our submandibular, our submental, and then we have our superficial cervical, deep cervical chain, our post-cervical, and then can you raise your shoulders up a little bit? And our supraclavicular. And I'm not feeling anything with those lymph nodes. There's nothing palpable, which is a very good sign. And if I did feel anything, I would be assessing to see if it was nodular, so kind of like circular in shape, and then if it was malleable or squishy or fixed and hard. But I didn't feel any of that, so that's good. Okay. Now we're going to be assessing your pulse, and I already inspected your mouth and gums, and your trachea, and then we'll continue with your range of motion of your neck, okay?
Okay.
Okay, so assessing your carotid pulse. Beautiful.
I could rip my pulses out.
I know, you got great ones. So it's a nice, even, it isn't bounding. I'm not feeling it a lot of pressure on my fingers. It definitely isn't faint. I would say it's a regular rhythm and about a 2+.
Okay.
So beautiful. And I can see that your trachea is midline, so I'm not having any concerns for anemia or tension for hemothorax. And we already inspected your mouth, so that is looking good. I'm just going to do your range of motion for your head, neck, and shoulders. So can you bring your chin down to your chest? Perfect. And then up and look towards the sky. Beautiful. And then turn it all the way to the right, all the way to the left. Awesome. And we already assessed against resistance for that accessory nerve. Great job. Okay, now we're going to be assessing your cardiac. So looking at your heart, going to be listening with the bell and the diaphragm of my stethoscope. Okay. So I'm going to be listening to 4 different parts on your chest, kind of around your left breast tissue. Okay, so I'm going to move your badge out of the way. So we have the aortic, pulmonic, tricuspid, which I'm going to deviate to just a little bit. Beautiful. Our mitral. Fantastic. And in a moment, I'm going to be auscultating the apical pulse, but I'm not going to do that just yet. So that was with the diaphragm. I heard a very clear S1, S2, that nice lub dub. There wasn't any galloping or irregular beatings, and I didn't hear any murmurs. Okay, so listening again to the aortic. Pulmonic. Tricuspid. Again, I'm going to just deviate you one more little bit. Okay, and then that mitral valve. Okay, and since I have my stethoscope already on, I'm going to auscultate your apical pulse and compare it with your radial pulse. If I can have your hand. And it is even. So I am hearing the S1, S2 of your apical pulse, and it is in line when I'm palpating with your radial pulse, which demonstrates that you have equal and well perfusion throughout your body.
So all the beats are getting through.
All the beats are getting through, exactly. And your skin is definitely reassuring for that. All right. Now I already assessed your capillary refill. I'm going to go ahead and have you lay down, actually, so I can assess your belly and then the rest of our cardiac assessment. Okay, and if you can just slightly turn your head towards the wall, I can see that you do not have any jugular vein distension, and it is normal to not see anything. What I would be concerned if there was a bulging JVD. And then I'm going to be looking at your, I'm going to save the pedal pulses for your lower extremity assessment. So, just make sure that I go up for that and assess for edema at that point as well. Okay. Moving right along, so we're going to be doing your lungs. So maybe I shouldn't have had you lay down.
Can we sit back up?
In a moment. We'll do your anterior, then we'll do posterior. Okay, so I am noting your respiratory rate and effort. We took your vital signs earlier. You're well within normal limits with a rate of 14. And I'm noting that you are not in any respiratory distress. And that would be indicative of if you were in a tripod position, using accessory muscles, having a rapid respiration rate, or reporting signs of shortness of breath, or if I heard any adventitious sounds such as stridor. So I'm going to go ahead and listen to the anterior portion of your lungs. Make sure I switched it back to the diaphragm. Okay. And I should be hearing clear intake and output. So just take a nice deep breath for me. Beautiful. And in a real patient, it's best practice to do this under, they're directly on their skin. Beautiful. I'm going to kind of deviate you again. I did this wrong. I think we're going to have to redo that one. That's okay. I did enough, right? It's 4 on the front and then 4 on the back for 8 spots total?
Yeah.
Okay, I thought so.
I'd
And we're not expecting them to do the sides,
Okay.
are we?
I always do in the hospital.
Oh, okay.
Yeah.
Well, then we can demonstrate it in the video.
Okay.
Okay, so our right side would have 3 lobes, and then our left side would have 2 because it's making room for our heart. So I'm going to have you just raise your arm up for me and assess in there 3 spots. Okay, you're actually nice and clear. I know that you have that cough, but I think it's just upper airway congestion. So
That's good.
I'm not concerned for any pneumonia or consolidation at this point. And then it'd be 2 locations on this side. Thank you. What a good patient doing what you're supposed to. Beautiful. Okay, I'm going to go ahead and have you sit up, Professor Miller. Go ahead and
Okay.
face that way, and I'll be on this side. We're going to do a couple different tests on your posterior. So first I'm going to be listening. So lots of deep breaths. I know you're hyperventilating. I apologize. Beautiful. Okay, still having my stethoscope on, I'm going to be assessing for consolidation. I'm just going to go directly down this time. So I would like you to repeat a simple phrase, 99 for me, okay?
99, 99, 99, 99, 99, 99, 99, 99.
Okay, beautiful. And so with that consolidation test, I didn't hear any changes in pitch. It was slightly muffled, which is exactly what I'm anticipating with that. So there was no indication that area of your lungs were denser than another.
Okay.
Okay, so now I'm going to be testing for firmitus, which is on my ulnar side of my arm. And I just want you to repeat that 99 again for me.
99,
Okay.
99, 99, 99, 99, 99.
Beautiful. And so I was feeling that vibration on the ulnar side of my arm, which was demonstrating that you have good, not only vocal, but airflow throughout all fields of your lungs. Fantastic. I'm going to refer back to my document to make sure I'm not missing anything. And I was doing posterior lung expansion. So I'm making my way over here again. Which students, this is perfectly appropriate to be utilizing your paperwork in this way. All right, so putting both my fingers on your back, just go ahead and take a nice deep breath for me. Okay, beautiful. And so with that diaphragmatic expansion, I can see that my fingertips went out and came back in, showing that you have thoracic expansion.
Okay.
So that's fantastic. You're getting an A+ so far. Okay. So now if you would like to lay down one more time, I'm going to be inspecting your abdomen. Is it okay if I pull up your shirt a little bit?
Yeah.
Okay, so I'm pulling up your shirt and then down with your pants just so I can see your umbilicus, okay? Awesome. All right, the first thing that I'm going to do is inspect, and I can see that our belly is nice and flat and round, and that there isn't any obvious signs of trauma or infection. I'm not seeing any open wounds, not seeing any unilateral swelling or bruising that I would be concerned about. The next thing I'm going to do is auscultate in all 4 quadrants, and you stated that you weren't in any pain.
That's correct.
Perfect. So if you were in pain, I'd be avoiding that spot till last. So let's go ahead and take a listen. Alrighty, so I would say you have normal reactive to hyperreactive bowel sounds. I think it's getting close to dinner time. I could hear that tummy telling me that you were wanting something to eat. Now we're going to do some touch and feels on your belly, and I want you to tell me if you feel any tenderness. Okay? So I'm doing some light palpation. Anything? No? Okay, then a little bit deeper. Okay. Anything? No? Okay. And I'm going to do the deep The rebound test, okay? So, nothing?
Nothing.
Okay, and it should be on that rebound if you were to experience anything for a positive test of appendicitis.
Okay.
Thank you very much. You can replace your clothing. And I didn't feel anything on palpation. Everything was soft and malleable. There wasn't any firm borders of organs, and it didn't cause any pain.
Okay.
So I don't have any concerns for your gastrointestinal
Okay.
tract. Okay, so now we're going to be testing your kidneys. So I'll have you set up one more time for me, please.
Okay. I could turn that way.
Oh, that works. Okay, this is testing for CVA tenderness. So placing my hand right above your hip. Any pain with that?
No.
Nope. Any pain with that?
No, but I don't have a kidney on that side.
Oh, aren't you a medical marvel? Okay, well, I'm glad you don't have any tenderness on that
That would be
side.
bad.
Any phantom kidney pain.
Right.
Okay, so now we're going to be assessing your musculoskeletal assessment. I'm going to be looking at your upper extremities and your lower extremities. So if you could raise both your arms up for me. Okay, and then push up against me, push up, push up, push up. Excellent. And then push down, push down, push down. Ooh, good job. And then can you raise your arms up above your head? And your other arm. Excellent. Can you put them out to your sides? Okay, and then bring them down to your body. So we had full range of motion in your arms. Can you stick out your hands again one more time for me? See that rapid alternating movement. Beautiful. We have full wrist rotation. And then can you create a fist and let it go? Beautiful. And then I'm also going to be assessing your hand grasp. So go ahead and squeeze my fingers. Oops, sorry. Squeeze, 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 squeeze. Nice. Good job. You're so strong. And then I did the strength against resistance. I didn't grade it. So I would definitely grade you at a 5 because you had some really good, strong resistance. We tested your range of motion. And so now I'm just going to palpate around, seeing if there's any swelling or deformity or pain.
Mm-hmm.
Anything? Nope? Okay, beautiful. And we did note that we had some very mild deformity on your right hand but we noted that was arthritis. And I don't think you really have any on your
Just
left.
starting there, but it's,
Oh, man.
I know.
I know.
Oh, well.
Oh, well. Okay, so now we're going to move on to your legs. And if you remember from earlier, I skipped edema and then capillary refill of your feet as well as your bilateral pulses. So I'm just going to take your pants up to your knee. So I do see that we have some scars on here. Are these from your knee replacements?
Yes.
Okay, well,
Bionic.
they look good though. I'm not seeing any keloids or definitely no signs of infection. And your anatomy looks in line. There's no trauma. Your kneecap is exactly where it's supposed to be. Wonderful. Okay, and I'm not feeling any edema. Beautiful.
Not bad for 80 years old. Huh?
I know, you're doing great. Let's move the camera real quick. So I'm going to be assessing so they can see the post-tibial, and it's good to do it. It's on the medial side of this malleolus, to be doing it unilaterally to make sure that we are getting equal perfusion, which we are, and then finding that pedal pulse. Your pulses really are good.
They really are.
And I feel that is equal, and the rhythm is regular, which is good. Okay, looking at your toes, looks like we might have just a little bit of arthritis as well on this left side. Did you have any procedures over here?
That was a work injury.
Oh my.
I was working at a hospital in an office, had leather shoes on,
Oh dear.
and I dropped a bookshelf,
Oh.
just the shelf, not the books, and it landed on my toe, went straight down to the ER. By the time they got it, the hole melted into it, the blood had already clotted.
Oh
So
man.
then I've had to have ingrown toenail from both sides, so I have just barely a toenail left.
Oh man.
And
Poor
that's,
Professor Miller.
but that was with shoes on.
Wow.
yeah.
Well, I'm glad you still have a toe.
me too.
And I can tell, and this is actually a good note for you guys too. If your patient has very calloused toes or maybe even diabetic feet that don't have a kind of an atypical nail bed, you can actually go right above it and still see that capillary refill. So right above the nail bed.
Or if
So
they have dark paint on them.
yes, or if they have dark paint on them. So it looks like you're exactly at a 2, which is perfect. That is perfect. Okay, so since we're talking about our neurovascular assessment, I'm going to feel the motor ability of your feet. So push down like a gas pedal on both sides. Great, and then pull up for me. Woohoo! You're definitely a 5+. And then I'm going to be testing your range of motion. So go ahead and bring up your knee. Beautiful. And then the other side. Great. And then you already showed me your ankle. Can you wiggle your toes? Beautiful, beautiful. Okay, so you've got full range of motion. And I'm going to be testing you against resistance. So I want you to raise your legs up, raise up, and then this side, raise up, raise up, raise up. Awesome, awesome. Definitely have good motor strength. And then finally, I'm just going to be palpating on both sides. Any tenderness?
No.
No? And I definitely do not feel any swelling, deformity, or noting any discoloration. So thank you very much. Finally, we're going to be assessing your gait as well as your balance, which is the other aspect of the vestibular-cochlear nerve that I forgot to mention earlier. So since our camera is already set up, if you wouldn't mind taking a few steps towards the fluid cart. Okay. And I can see that we have an overall even gait, maybe just a little bit of favoring your left side, but that would be
It's
related
because
to
of what
your,
it is.
to your knee operation. So doesn't look like you're walking with any pain or discomfort. No? Looks good. All right.
Okay.
So now we're going to be doing the Romberg test. So I'm going to be standing next to you, and I would like you to close your eyes. We're going to stand here for about 15 seconds, and a little bit of swaying is normal, but falling over is not. So beautiful. So you're negative for that. You have good proprioception, good balance. Okay. So I'm going to go ahead and put that video back. Okay. Well, Professor Miller, it was wonderful to be able to do this head to toe with you. I just want to make sure to answer any of your questions. Do you have any questions about that assessment?
No.
Was I clear on the results that you had?
You were.
Wonderful. So I'm going to go, I'm going to be back. I'm going to go document all of my findings.
Okay.
Want to make sure that the bed is in the lowest position,
Mhm.
that your collar is within reach, and that the bed rails are up ×2. So I'm going to go ahead and do that for you. All right. And then that will complete our head to toe.
But I guess I better get in bed.
I'm locking you away.
Okay.
Okay, thank you. We can trim it.